If you have mouth sores caused by canker sores, cold sores, braces, radiation treatment, or cancer treatment, this medication can provide relief. It can also help with temporary mouth pain from dental procedures like cleaning, tooth extraction, or removal of tonsils or uvula. The paste or gel form helps it stick to the inside of your mouth, forming a protective layer to prevent further irritation and pain. It's important to follow the dosage instructions and take it at the recommended times for best results. When using this medication, be sure to only apply it inside the mouth and avoid getting it in the eyes or on the skin. It's important to follow the directions provided by your dentist or doctor, as the dosage and usage instructions may vary depending on your medical condition. Different brands of this medication may also have different directions, so be sure to carefully follow the specific instructions given to you. Even though it's not meant to be swallowed, it is safe to do so if it happens. After using this medication, it's best to wait at least 1 hour before eating or drinking anything. Using this medication regularly is essential to receive the maximum benefits from it. Try to use it at the same times each day to help you remember. Make sure not to exceed the recommended dose or use it more frequently or for a longer duration than instructed by your doctor or dentist. The recommended daily limit is 8 teaspoonsful, 40 milliliters, a day. If your condition persists or worsens, be sure to inform your doctor or dentist. This medication usually has very few side effects. However, if this medication is swallowed, constipation may occur. If you have any unusual effects, tell your doctor, dentist, or pharmacist promptly. Remember that this medication has been prescribed because your doctor or dentist has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. If you experience any unusual effects after taking Sucralfate Malate, polymerized paste, such as constipation, rash, itching, swelling, severe dizziness, or trouble breathing, make sure to seek medical help immediately. And remember, this medication has been prescribed to you because the benefits outweigh the potential risks. If you have any concerns about the side effects, be sure to talk to your doctor, dentist, or pharmacist. Before taking Sucralfate, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to also discuss your medical history with your doctor, dentist, or pharmacist before using this medication. If you are pregnant, Sucralfate is safe to use as directed, but it's best to consult with your doctor before breastfeeding to ensure the medication does not pass into breast milk. If you are planning to have surgery, let your doctor or dentist know about all the medications and herbal products you are using. When taking Sucralfate Malate, polymerized paste, it's important to be aware of potential drug interactions. Certain medications may interact with Sucralfate Malate, affecting its effectiveness or increasing the risk of side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your healthcare providers. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's important to communicate with your doctor, dentist, and pharmacist about all the medications and products you are using to ensure safe and effective treatment. If someone takes too much of this medication, it's unlikely to cause an overdose. However, if they do experience serious symptoms such as passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to always take medications as directed and to seek help if there are any concerns about potential overdose. Remember, this medication is prescribed specifically for your current condition. It should not be shared with others or used for a different condition without the guidance of your doctor or dentist. If you require medication for another condition, a different medication may be necessary. Always consult with your healthcare provider before using this medication for any other purpose. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Remember to store this medication at room temperature, away from light and moisture, and keep it tightly closed. It's important to keep all medications out of reach of children and pets. When you no longer need this product or it reaches its expiration date, be sure to properly discard it. You can ask your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.